Ooh. Hi. Hi. Happy Monday. Hello. How's it going? Hey, y'all. I'm from Texas. Where are you from? I live in a town about north of Dallas, so we just tell people we're from Dallas. Pakistan, very cool. How's it going over on Instagram? Hey y'all, Facebook, hello. Bad anxiety today, really bad. Well, I'm glad you're here. And anxiety doesn't make you feel like things are gonna be okay, right? It feels like Nova Scotia, hi on Instagram. Anxiety makes you feel like worst case scenario, like everything's not okay and awful. And it is a feeling that will subside. Like it is a feeling that you can, like, it's really hard and it feels really scary, and you can be really strong and resilient and get through the day. So I hope that you take care of yourself today. That is what's most important to help you, like, just get through and manage on a bad, anxious day. Worried that something bad's gonna happen. Man, that's the thing about anxiety. It makes you just think about, like, the future, you know, like just something, it takes a thing and makes it become this, like, awful thing that you can't stop thinking about. Yes. Talk to your doctor. That's a good plan. And a lot of like breathing to bring you into the moment, to remind you I'm safe, I'm okay right here, right now. Hi. Hello. Welcome. See, that question about the drink supplements I recommend is hard. I'm not a nutritionist. I'm a therapist, a certified eating disorder specialist. So I'm not the, like, person trained in knowing about, like, nutrients. I mean, I know, like, a general knowledge from going to trainings and those sorts of things, but I think that a registered dietitian is best to help you with that. I think my go-to usually with people is any, like, just, like, Ensure is a big one, but I know there's, like, a taste issue with Ensure. So you know, like, how can you make a shake, a smoothie, a drink like that at home even, you know, that just boosts up and gives you all these, like, really full, yummy things. Thank you. Do I have any tips for the first few days of starting recovery? That's a great question. Yes. Good for you. Congratulations. I actually have for you, if you go to recovery-academy.com, I have a free course there for you. Like, it's an on-demand where I talk about recovery and, like, the process of recovery and sort of, like, the way to kind of think about, it's not like steps or anything, because it's certainly like a journey, but it is more of the, I guess, how I like conceptualize or break down, like, eating disorder recovery treatment and kind of where you want to start and where you go from there. I break that down, and that's free for you at Recovery Academy. Aw, thank you. Thank you. Did I end up going on vacation? I did, and it was so good. We went to Oregon. All of our plans that we originally made worked out. Thanks, G Guest 92. I know it's hard to be in recovery. I hear about it every day. You literally just finished your meal. Well, glad you're here. This is still a great place, even if you're not eating. If you're eating, cool. I'm clearly eating. We just like hang out. Glad you're here. I have an eye appointment in a few minutes. I don't hate it. Here's what I hate about going to the eye doctor. I've had to have glasses since I was very young, like probably 5 years old. So it's a thing I do all the time. So like, it's not that big of a deal, except for where they blow that puff of air in your eye. It's so, I hate it. It's scary. It's like scary. It freaks me out. You have to sit there and not blink, and you know it's coming, and you're just like having to hold your eye open. It's the worst experience. So once that part's over, it will be fine. You're having spaghetti? Yum. This is like a tortellini we made yesterday. TikTok is a great distraction. Yes, right? Because then you do fidget, because you're like expecting it and you know it. Like, I've done it every year for 100 years. So like, I know it's coming, and I always pull back. So it's like, oh, I just want to get that part done with. Odd question. Are you technically in recovery when you give up? See, don't make it so black and white. Recovery is not black and white. Healing isn't black and white. It's truly a journey. It is you learning how to care for yourself, be kinder to yourself, respect yourself, and how food and your body plays a small role in that, and unfucking messages and belief systems about food and our body. I know I made that sound really easy, but it's not as easy as just like, I'm 100% motivated to do eating disorder recovery every day. Like, no one eats perfectly. So you can't have a perfect food day in recovery. You know what I mean? Like, it's not about that. So I do think there are days in your healing journey where you're just like, I can't do this. It's too hard. It's too overwhelming. And that's okay. I don't want to say that's not recovery. I think it's just, again, healing is going to be something you're going to be doing every day for the rest of your life, I think. And so just what does that look like today for you? Oh, thank you. Recovery and healing is a day-to-day journey. Yes, exactly. And it is, because intuitive eating, like, not eating disorder folks, just normal people, right? Normal, neurotypical people, right? When they're eating intuitively, it's like they are taking it day to day. Like, they're really kind of in the day, in the moment. What do I feel like eating? So it's not I have to eat this way every single day for the rest of my life. It's I'm going to wake up today, and food plays a part in it, but it's an intuitive part of my day. So it kind of just, like, I don't have to do a lot of planning. I think in the beginning of your recovery journey, food feels really hard, and there is a lot of planning, which is why it's great to work with a dietitian or an eating disorder dietitian if you have access to that, or getting as much help and information as you can about intuitive eating. So because it's every day. How are you going to check in and care for yourself? You're not going to be stuck forever. because healing happens. I see it every day. It's just, I think it's reframing how you tell yourself what it looks like, you know? Like, if food just wasn't that big of a deal, what would life look like for you? This tattoo, it is Italian for, and it says, I can do all things in Christ who gives me strength. Do I have any experience dealing with ED and ADHD? I do. I see clients that have, yes, I have worked with those together. So you're feeling pretty good, body positive lately. That's amazing. Congratulations. Good for you. How do you handle setbacks? We all have setbacks though. Like every single day is a setback. There are bad things that happen. It's not about doing it perfectly. What do you need to do to take care of yourself? And I think the more that you do that, the more that you take care of yourself and tune in and become aware and aware, then you can start to, you're going to notice you're making changes. You're going to notice that you respond differently, and that you know, can you learn from the setback? You can't ever change it, right? And it's not about beating yourself up. It's, is there an opportunity to learn here so that I can try differently next time? And next time you might not get it right. That's okay. You're showing up and you're doing the best that you can in the moment. That's really important to remember. We're all human, you're right. 3 a.m. where you're at. Goodness, that's early. Or late. Glad you're here. Sorry you're having a hard night sleeping. Is it possible to get out of a relapse without help? Why would you want to? That's my question. It is so hard to ask for help. That is true. It is early. Yes, very early. Snow fence. Were you joining us from Australia? Yes, that's you. It is very early. Any tips for antidepressants that make you sleepy all day? So, A, talk to your doctor about that, first of all. But if it's an energy issue throughout the day, you know, things like taking a get up and go for like just a walk, like every hour I get up and I take a little walk around my office or whatever, Can you go out? I think it's those things of like, what brings you energy? What are little things you can do throughout the day? I don't want to say like drink a coffee, because caffeine is certainly will give you some energy. Eating a snack is a great way to get some energy throughout the day. But are there like, can you get outside? Do you need to stretch your body? What if you did like a little like breathing thing, like a grounding thing at certain points throughout the day? Those are some tips, some things you can do throughout the day to give you some more energy. But if it's like a medication issue, you know, I would definitely be talking to your doctor to see if that's a side effect that will go away and improve with time. If not, then you're going to have to think about what are those daily, you know, practices and things you can try when you feel low on energy. These are different things that you can use to help energize you. It does feel like you get stuck in a rut because a lot of the days just look the same. We do have a lot of habits of thinking, habits of doing, habits of existing, and sometimes we think that it's normal, or we think that it's like meant to be that way. And y'all, I mean, all healing is, all this work is, all recovery is giving yourself permission to learn more about yourself and like give yourself time to understand how you think and understand how you feel. And truly that awareness and that understanding is what helps you do better, go better. It's not a cat. It is my dog, Finway. Hey, Finny, come here. They want to see you, handsome. I don't know that you can get on the... Oh, yeah. Now he's over there. Now you can see. He's a big boy. And there is a lot of stigma. You are so right. I can't handle adulting. There is a lot of stigma in eating disorder recovery and treatment, in mental health, in just healthcare, unfortunately, which makes it feel like you're doing it alone a lot of the time, you know, which is why probably to the question of can I do recovery alone, you know, are people hearing you, believing you, validating you? I know that happens. And, I lost my train of thought looking at these comments. Thank you. So I'm going to hop off, y'all. I have to get ready for this eye appointment. So I will see y'all next week. Bye.